next up is our panel on international perspectives on AI. And you'll see on our agenda today, we're going to talk a lot about AI and a lot of the things, when you think about AI, you think about ethics and how it's applied in healthcare. Those focuses can apply not just to the United States, of course, but to patients and people all over the world. So I would like to invite Dr. Nathaniel George to the stage. Thanks for coming up. Please have a seat. And our other panelists are joining us remotely. So maybe let's talk a little bit about some of the global trends in AI. So several countries are looking at investment and innovation, investing heavily in AI research and development, and the focus is on economic growth and tackling complex global issues. Also ethics and governance, where the goal is to ensure AI development and deployment is transparent and fair. And notable initiatives include the OECD's AI principles and the EU's Artificial Intelligence Act. And I know the African Union also is looking at policies for AI. And then, of course, while there's some collaboration among countries, there's also competition and something that we'll talk about as well. So I see Mr. Arnaud Val Esteve has joined us. Thanks, Arnaud. Thanks for being here. And is Dr. Tazi also on? Hi, Alberto. Thanks for being here. So let me properly introduce you. So Dr. Nathaniel George, sitting here with me, is the Impact One Global Maternal Health Innovation Fellow and a Stanford Biodesign Fellow. And Dr. Alberto Tazi is Director of Predictive and Preventive Medicine Research Unit at Bambino Gesù Children's Hospital in Rome, Italy. He's also president of the International Society for Pediatric Innovation, where I've known him for several years in that work. And Mr. Arnaud Esteve is head of innovation department at Hospital Saint Jean de Dieu, and his work is really focused on cutting-edge healthcare innovation and pediatric care. So thank you all for being here. So I'm going to ask you a question, but also feel free to say a little bit more about your personal work in AI and healthcare. So Nathaniel, given your role with the Impact One Global Maternal Health Innovation Fellowship, how do you see AI transforming maternal health on a global scale?
First of all, to the organizers, great job setting us up after Daniel's presentation. So that was a very wonderful presentation, Daniel. So I think he has said it all, and he has elaborated a lot about things that also intersect with what's happening in maternal health globally. I can speak specifically about Africa, and I'll say that there are three major ways that I see AI impacting maternal health care. First of all, we have it's doing a lot, helping out with early diagnosis. Second of all, we see improvement in maternal health outcomes through improved quality of care. So things like the clinical diagnosis support, for instance, is making a difference. And then finally, my biggest, the one I'm most excited about is that it's expanding access in low resource settings. I'm very happy to go into it, but things like telemedicine, reducing time for training, as well as task shifting. So these things have very big impact. I would say that as exciting as the whole world is around AI, the impact of it is probably going to be most felt in places like Africa, especially the remote areas. I think that's where it will be very difficult to ignore the progress and the benefits of AI. So it's pretty exciting what's going on there.
That is really exciting. Thank you, Nathaniel. Yeah. Alberto, to you, can you tell us about a few of the projects that you're following and how that could impact your clinical practice and at the hospital?
Yeah. Yeah, thank you, Charlotte, and good to see you all. After a presentation like the one from Daniel, everybody would be excited, but then you have to work to find out the right ways to make it real. And actually, we are currently following several exciting things. One project is about creating a digital twin of tumors, for example, for informing organoids. Another one is predicting how long the patients will stay in the clinic before discharge, which will be more on the operational side. And we have a third one, which is about developing a platform for ensuring cybersecurity of patients in remote monitoring. And these are very severe patients with cardiac failure, for example. So these three things are extremely exciting. At the same time, are extremely difficult to achieve because when you come down to the real things, you have to get the right data, you have to develop the right algorithms, and then you have to be real and implement everything in the clinic. Uh, Nobody realizes how it's difficult and challenging to implement the AI in the clinic. It's well, it might be strange to say, but one of the most difficult things is implementation. It's not the technical development. However, we are lucky enough to work in an international environment where several things are going on, and we're trying to make these applications a real in the clinic. Now, the challenge is going from these local applications to something which is more widely applied. And I perfectly resonate with the things that George was saying. I think that the more we are able to share our data and to make these applications for the collective benefit, and the more we will get real impact in the clinic and for all patients all over the world. This is the ultimate possibly goal that we have all over. However, again, we are very much engaged in these activities. We're also searching for new projects because we feel like having more practical examples and having the hands-on is also meaning that we can translate something which is often just a lesson heard from Daniel or read on scientific papers and move to something that can happen really in the clinic.
Thank you, Roberto. Really good points there. I'm going to ask Arnaud if he could also talk about some of the impactful innovations in AI that they've integrated at Hospital Saint Jean de Dieu, specifically for pediatric and maternal care.
I was saying first that thank you very much for organizing this amazing event and to have the honor to speak and bring our vision from Barcelona and after such an impressive presentation from Daniel. We are also working in some projects in AI, mainly focused on three aspects. First, in terms of helping develop algorithms that help detect cardiac deterioration in patients with congenital heart disease after a surgery. Also helping on detecting sepsis following the Phoenix criteria in patients in the ICU. So those would be more on the clinical side and help on the diagnosis. We have another group of projects that we are doing more on the operational side to try to improve efficiency, detecting in 24 hours advance the occupation that our hospital would have on emergency care or in hospital stays, and that's been running for a while, and it's working good for improving the prediction on the occupation that we could have. And the final one, it's more on the ecosystem and networking side. And here we have projects together with also Bambino Gesù, with Alberto, but also with a network of European projects in which we are trying to generate a federation of hospitals at a European level with also FEMS projects, in which we federate our data the same way, and we try to navigate the complex regulations in EU to try to improve and accelerate the development and then the validation and application of these new algorithms into the clinical side. That, of course, and as you know, in pediatrics, one of the things that we lack sometimes, it's the numbers, the amount of patients, and having so many different EHR systems in the different hospitals, trying to federate them and trying to generate a network at a European level helps accelerate that, and we hope that that can also help adopt products that are developed from other startups or companies. But of course, lots of challenges going on, and a lot on then making these new developments really arrive into the clinical side and the bedside, and generating the impact that we hope AI will have.
Thank you, Arnaud. I think each of you spoke on kind of the importance of collaboration and working together, and that's one of the trends and global trends that I noted as well in preparing for this panel. Arnaud, I think you and Alberto are working on, or two of several people working on the project that you just described, and sharing data and really kind of helping to ensure that the European Union and the other policy-making bodies are supporting that ability for hospitals within the union to share data. Is there anything in particular that you and Alberto have worked on together, or is it just that you're in Spain and Italy and they're both part of the EU? What is it that, is there something specific you could speak to? Either of you?
So one of the projects that we worked together, it's called Accelerate. It was a European funded project that focused on generating algorithms to improve the process of the delivery of care in neuro-oncologic patients. It was linked to what Alberto was saying. It had two main objectives. On one side, generating a virtual assistant that can help patients at home, improving the patient experience and the collection of data from those patients. So having like an extension of the clinical team at home of those chronic and complex patients that need a lot of care and support also from their parents, their family, and their surrounding. And on the other side, inside the hospital, developing algorithms that can reduce the time to surgery, as Alberto was saying before. So what we work, and here the challenge was to define the structure and the data in a way that can be used from both sides, and then developing the algorithms, but also all the legal, ethical, and regulatory that have to accompany all this to make it a reality and arrive to the patients at the end. Still, it's a work in research and in process, not at the clinical application. We arrived into a clinical pilot, and we are continuing to work on those lines.
Thanks, Arnaud.
If I can add a few words, Charlotte,
Of course.
it was so challenging coming up with a solution for sharing the data and trying to move the data from one place to another. Then, our data protection officer is next door to mine. We became best friends after all these fights, because the discussion is so difficult when you are not prepared to understand what are the single points that you have to match with the requirements of a research project. And on one hand, it was very difficult to come out with some technical solutions. On the other hand, we became expert of the ethical and legal nuances and the requirements and the regulations that are required to make a safe data transfer from one place to another. This was something that we can carry in to other projects. On the other hand, we're also very interested in technical solutions. Federated learning is one of the magic words. We made some technical tests. One of them we made with Stanford itself, and was successful. So this is definitely possible. It requires a different mindset from researchers, but also a shift in the paradigm of data transfer, which is very, very still the old-fashioned, because everybody thinks about a centralized database that in which we move data from one place to a central repository, which is completely nonsense these times. So this paradigm shift helped us also to discuss with the clinicians about the need to move on. And hopefully we will have the future solutions that we're exploring right now that will be powered by this approach, which is both technical, privacy preserving, also making best friends among the data protection officer and the ethical committees, hopefully.
Great points, Alberto, and I agree. I think all of us in this space are getting close to our data compliance, privacy officers, as we seek to move forward with, implementing and developing, AI solutions for healthcare. Nathaniel, can you talk a little bit about maybe some of the collaboration that you're doing? You mentioned speaking to Africa. That's a huge, of course, continent. I know that Kenya and Nigeria and certain other African countries are developing policies on AI. Can you talk a little bit about maybe some of the work you're doing, maybe in diverse settings, maybe within Nigeria, outside of Nigeria? I know you're also doing a lot of work here in the United States as well.
Yeah, thank you very much. So my work as an Impact One fellow is broad around maternal health as a whole. Yes, there are areas where the solutions can end up being AI based, but I would love to talk about like the general direction things are going in terms of collaboration in Africa. Just like you mentioned, the organization of the African Union is kind of coming together because this is one of the technologies that I see the whole world is moving kind of at the same pace. We're all sharing the same concerns. We're all looking at the same things. So because of that pace, I think one of the biggest areas of concern that we're having back in Africa is the development of robust ethical frameworks. So that's one of the main areas where people are trying to collaborate. Like we definitely need a designated driver, right? A lot of us are very excited about it, but we need people who are looking into how to ensure that privacy is being protected. So we're seeing that on a grand scale between countries. And then, yes, locally, there are a lot of companies trying to come together as well to collaborate and then come up with specific solutions. So my own personal experience has been working around physician burnout. There's been a lot of like brain drain around the country and trying to work with other people to see how we can reduce that burden on the physicians, especially at the lower levels, the primary healthcare levels. So in those regards, I'll say yes, absolutely. Collaboration is super important.
Thank you. When you think about the innovating for equity and like you said, we're kind of all starting at the same point, right? With AI, where each of us has an opportunity we feel that we have the opportunity to make a difference as we're heading toward the very exciting future that Daniel spoke to. And so when you're looking at that innovation, like with the monthly Impact One Innovators Forum, there are a lot of startups who come through there monthly, and typically you're in that forum as well and asking real questions to help them determine how to apply their solution to countries in Africa. Is there something that you think that helps make a level playing field going forward? It's like there's an opportunity here to really be thoughtful in the development of AI versus waiting on the back end to say, oh, this AI is not, working properly or doesn't see all patients in the same way or in a equal and equitable way. Is there something that you think that could be done there?
Oh yeah, I absolutely love that question. I think in this regard, I'm actually happy about the direction things are going. It's really all about having everyone brought into the conversation. And I see that happening a lot where the major stakeholders, the people who are being affected, are already being engaged at certain levels about the direction that AI is going and how they can be part of that. So we see that, take for instance, when we're talking about maternal health in rural areas, we have many examples where you see people being engaged. Take for instance, you have community health workers, you have traditional birth attendants. These are people who are almost never really brought into the fore of the conversation,
Yes.
contributing to those discussions at a very early level. So I think we're getting it right. We just need to continue to open up the space for conversations as we go forward. But I'm seeing a lot of it so far, and I'm excited about that.
That sounds exciting. Thank you. Alberto, can you tell us whether you think regulation is slowing down the development of AI, or is it increasing patient safety or some other aspect of healthcare which makes it worth it?
Tough question, because everybody's complaining about the slow progress of AI, at least in this part of the globe, where regulation is extremely important. Let's be very clear. Regulation is extremely important because actually privacy is a right, and we are working with children, and actually a problem in privacy or in ethics and any bias in any algorithm would have a very big impact on a population which is very vulnerable. And that's why we're very worried about that. We actually worry a lot about these things, even if we would like to be faster, because actually we would like to develop AI algorithms as soon as possible to reach out everyone who is in need of a diagnostic solution, of any support for clinical decision, and make the best for this population. We must find out the right balance. And this results, at least for our experience, in a lot of discussion with both sides. You can understand that we discuss a lot with the people responsible for ethics and regulations, and we were able to make a very good relationship with these people, because discussing means also being on different sides, but at the same time finding out solutions and explaining all these things also to people responsible for the development of the algorithms. Again, we try to make some proofs of concepts in our sandbox, for example, and make small experiments. But we know very well that we should be very analytic and very specific and precise about the potential bias that we have in our AI solutions. For example, we know very well that some algorithms that are trained with data coming from other continents might not be as accurate as originally declared, because they are applied on a different population. We are very much engaged in validation studies, external validation studies. And this, I think, must be something that we should do very frequently, because it will be, I think, frequent that we will be provided with algorithms coming from other settings in which the training data, we're referring to other populations. We should be familiar with this process. We should be very also, we should understand that we should find any weak point in our algorithms before applying them on scale. And this critical thinking comes also from the experience that we have. So I feel again that we should find the right balance. We're on the right way. Sometimes we press for being faster. And I think this is a work in progress. And at the end, we're pretty much satisfied of the solutions that we found. We're also very engaged on the ethical side for having the right foundations for our algorithms. You may remember that we are also very sensitive to this argument, because Bambino Gesù is owned by the Vatican, and you can understand that ethics is of paramount importance when we develop our solutions. You also remember that even the Pope Francis, was publishing a declaration about the ethics of artificial intelligence, which is extremely important to understand. We hope that this balance that currently we observe in different parts of our globe actually will go to converge and try to find out a balanced solution which will be also useful for anybody all over the world. That's the main point.
That's a really great point, Alberto. And I think something that we're all thinking about, we've had that conversation many times and continue here as well with our groups and teams as we consider, ethics and governance for AI and really thinking about algorithms for AI solutions that you're bringing on board and understanding how they were trained and how they could be applied within your organization and then how you kind of monitor them, right? So there'll be another panel today speaking of ethics and AI, and definitely we could spend a whole day on that because that's of the utmost importance now and going forward. Arnaud, happy to have you speak on that, but also any other challenges that you're facing in implementing AI solutions.
Adding on Alberto's comments, I think one of the challenges that we have at the European level and that we are seeing in the network that we are built in for creating a pediatric health data space, let's say, it's this fragmentation that we see and the regulation that it's being that it's arriving, which helps to set some rules and some clear indications on the way of implementing AI at the European level, but at the other hand also it's challenging and provides more administrative work and process to really get into the implementation of that. I think that the main challenge that we have is that technology is going much faster than we are in adopting it. We see that not only from a regulation ethical point of view, validating point of view, as it was said, but also from a business model point of view. The models that we have now for adopting all these technologies and how do we pay for all these digital new solutions that clearly we've seen at the beginning in Daniel's presentation bring and we hope that will bring a lot of value, mainly in democratizing healthcare and the access to this healthcare to the most vulnerable ones, which pediatrics, it's a clear case, but still we need to also change the way we pay for all this, and we still don't have value-based models that really help adopt and accelerate this the adoption of these new technologies. And I think that's something in which we are working, but we are not still fast enough. And the second is on adapting all the processes internally in the hospital to be able to adopt all this. That's why, apart from the specific developments that we've mentioned at the beginning, structuring all this data and the processing in our hospital, it's also a challenge and one of the priorities. And we've recently have a new direction on data that is focusing together with the other directions on that, on trying to define the use and the implementation of these new digital solutions and AI at the hospital. But I'm also an optimist, as I said at the beginning, and I really think that all this technology, so we will manage how to adopt it because we have a population that is young, not only the patients, but also the parents and the families around them, that they live, and we all live in this with this kind of solutions. And although healthcare is sometimes slower in adopting these technologies, we must do it for them, for our patients, and try and find a way of making it possible, because they at the end demand and need new ways of service delivery. We all need new ways of service delivery, and we now live in a healthcare system that is not sustainable as it is. So I'm sure that technology, in that case, AI and these new solutions, properly used, can be clear solutions to that model that we have today.
Well said, Arnaud. I definitely agree. It's easy to kind of get overwhelmed when you think about structuring the data and the rules and everything that has to happen for in order to be fully integrate AI. But that being said, our system demands updating and moving forward, right? So we have to be excited by the possibilities that AI brings us and what that future can be, and be excited about shaping it and move forward with that, with always with a thought of equity in mind, that we're, really improving the health for all children, all expectant persons, all persons who need health care versus, a select few. So I think that's really important. I thought I had like 8 more minutes, but I do not. I do want to give our panelists a chance to say, make any closing statements that you'd like to leave our audience with. Really appreciate that. Nathaniel, would you go first?
So I'll just go off script here and say that I think AI, the way I imagine it, is like fire. The world has been shaped by fire. We've done so many different things with fire. But I look forward to seeing how we're going to use all the fire of the innovation we have going forward. But then we also don't want fire being the master. We want to use the fire, and we don't want the fire to dictate where it goes. So looking forward to the future, looking forward to all the innovation that lies ahead. I think it's a super transformative technology. Thank you.
Thank you. Love that analogy. Alberto?
Well, my hope is that clinicians, I mean, medical doctors and nurses, will embrace AI as much as possible and as soon as possible. I think that still there's space for and there's room for action by them because, you have still skeptical people that says, okay, AI is magic. Let's see what happens. And they're not directly involved in development process and also in the implementation process. The magic happens when they are on board. And this should be very clear. So AI is not a discipline which is outside medicine. It's a discipline which is in medicine. That's my message.
Thanks, Alberto. Arnaud?
But I hope that AI will help democratize healthcare access to all. I hope that it will accelerate innovation, and well used can have a huge impact in pediatrics, where we have a clear lack of solutions into the market, not only in terms of medicines, but also in terms of a diagnosis and medical devices. And I hope that it will be done in a well use that can help improve the healthcare system that we have now and the health of our patients.
Thank you so much. And please join me in thanking our panelists, Arnaud in Barcelona, Alberto in Rome, and Nathaniel right here in Palo Alto. Thanks so much.
Thank you.
Thank you.